This is a intumescent wide mature cataract. I have encountered few difficulties in this case which I wanted to highlight. As usual, I have used molecular weight OVD, which is sodium hyaluronate 1.4%, and I'm aiming for a small baby rhexis of about 2.5 to 3 millimeters, which is going well according to the plan. I usually use cystitome first, and then try to decompress the intralenticular pressure using my empty syringe, 1 ml syringe attached to 26 gauge bent needle, which I am doing now. See, now the moment you feel it is going out, it means that you have to change your technique. Wait, take a deep breath, decompress the lens as I am doing so, and you come out, refill the AC. Don't overfill. If you overfill, it will run away. And again start with the rhexis forceps. Rhexis forceps, it is easier to control the direction of the CCC. So I have changed over to the rhexis now, rhexis forceps or utrata. Here what happens is sometimes the rhexis, the tag gets caught. That is what has happened. It's very sticky and it gets caught. So you disengage gradually. Now the tag is tending to come outside the wound. So reposition the tag inside by using a little bit of hyaluron again, and make sure you're in a correct position. I felt my position was not right since I'm operating on the right side temporal phaco. I moved on little over to the temporal side, so I can pivot my utrata towards the inferior side, and I had more control now. Since I am in a good position now, I had more control and I was able to complete a reasonable 5 millimeters rhexis now. Now, after this, I was expecting it to be a soft cataract. It seemed to be a soft cataract, but it turned out to be a little bit leathery cataract. Now, the point I wanted to emphasize here is don't try to get a complete chop in your first attempt. Not needed. If you over attempt to get your complete chop in the first attempt, either you will end up with zonal adalysis or rhexis margin will tear away. There are so many problems. So partial chops are okay. See, I've ended up with multiple partial chops. Now with the dialer, when I'm doing a stepwise chop technique, and the smaller pieces comes on to my phaco probe very easily. As you can see, there is stepwise 1, 2, 3. My third chop, the piece comes on to the phaco probe very easily. So you don't need to always go get a chop which extends to the posterior plate. It doesn't matter if you get smaller chops also and partial chops also. It doesn't matter. You can always manage it very gently in the dialer in the next position, in the next step, as I have shown. Now the phaco part is over. Now I thought all my troubles are over and I can remove whatever little cortex is left. Now what I do is, since it is a little slightly smaller rhexis, I would like to polish the anterior capsule, or else it will go into fibrosis. I polish it thoroughly. I take out as much of equatorial cells as possible and I polish it. So the anterior capsule should seem very transparent. Now I am putting the lens. See, the leading haptics has come straight. Now I have not noticed that it is twisted. Now I placed the lens in the AC. I am doing it under the irrigation. I untangle the other haptic and try to place it in the bag, but it is not sitting in the bag. Now I know the leading haptic, apart from coming straight, it is twisted. I try to reposition the lens under the irrigation. Now I realize, no, this is dangerous. Let me come out, put some visco, and then manipulate it by using a dialer slowly. Again, take a step back, deep breath, reassess your strategy, what you need to do. Now you gently, what you need to do now is gently get the IOL. Now again, after the visco, again one attempt I did it. I wanted to do it inside the back. I could not, so I gently took out the lens and again deposited into the bag. It just takes 30 more seconds, but the end results will be beautiful if you have just 30 seconds of patience. And once I put the visco, of course you need to remove the visco thoroughly. Now as you can see, the lens is well centered. It is around 5 millimeters rexus, encompassing the optic of the